We gave some insight to that when we look at, some of the things that happen in the health sector. And this is maybe the second strong warning shot that has come from the Committee of Health, who've told us now that, apart from a system being unsustainable, that what we're looking at now is that it's very difficult for the country then to be able to deal with rising cancer cases because the prevention mechanisms are not strengthened or bolstered by resources. Now, when we talk about that, we're talking about screening. Screening is 50% of the job. If you don't have the proper screening mechanisms in place, it's very difficult. And we also know that cancer as a disease is largely treatable and managed, and that you can come from it if it's found early. So these are some of the conversations that we're having this morning. What is the situation where you are? We talk about a number of things, from education to health to the road network to things that in terms of services should actually be delivered to you. It's an opportunity for you to speak to us this morning, because lest we forget, while the politics takes center stage for the next 1 year, while all these things are being said, while money is being splashed around, because folks, it's going to happen. There's a lot of money that's going to be thrown into the system towards politics, towards elections, and it is not a Kenya unique thing. It happens everywhere around the world. So as that happens, to kind of take your attention away and focusing on the shiny things, we're saying this morning, lest we forget, there's still a lot of work to be done, and still a lot of attention that must be paid. First of all, lest we forget that county bosses play a significant role in running the country. And what we are fed is this circus that we see of people being chased and clothes being torn and others refusing to come before committees. Lest we forget that counties need to run. And this politics are sideshows and is taking people away from their core responsibility of making sure that the devolved units actually function. Lest we forget, you give your money to the counties. You Kenyans give your money to the counties, and we don't realize just how big of a role that is. You delegate your sovereignty, you give your representation to somebody else to then do the job. Now, when you see people running around like school children, chasing others back and forth because they declined to attend a committee which they are constitutionally bound to do, to explain what they did with public funds because you don't want to show up, I don't understand. Because you cannot tell me that, politics, because I want to do what and I'm on whose side, that is why they want me to come before the committee. Are you smoking something very potent? Because I don't understand. Why don't we just want to do the right thing? Lest we forget, the 2010 Constitution brought about these devolved units so that you could take development from a central place and you can move it around the country, and that you decentralize power, you decentralize the resources, and that in smaller bites you can develop these areas so that you can come together to be part of the bigger cake. Now, when you see these things that we see happening, because they're still not over it yet, and you find people saying, come on, just do your job, that's all we ask, this drama is not necessary. Lest you forget, the Constitution binds you, the resources that Kenyans give you also bind you, and just proper manners and good behavior binds you to then say, just come out and do your job. Lest you forget, the Constitution is what created these things that we're working around now. You have to then be able to be in a spot where you do what? Do your job.
Do your job.
We're just saying do your job. It doesn't look good. It's a poor showing at the moment, and I think we can actually do a lot better than that. We're going to hear from you on some of these other things as well. Dennis coming up with the next one, but 07321422650 or 07321422653. We'll hear from you this morning, and so that we can understand from your point of view, are there things that perhaps we have forgotten? We want to hear from you this morning. And so Lest We Forget gives us an opportunity to look into some of those matters and not keep them on the back burner, but bring them to the front so that they can be attended to. Somebody just sent me something and they said, lest we forget, this whole conversation about Nairobi began because we said that the city was swimming in filth and that it was terrible. The rains came and they washed many things away, including lives. But has that taken care of the Nairobi problem?
Nope.
Lest we forget. Lest we forget that the national government is now holding hands with the county government of Nairobi to then essentially be able to bring about some order in the city, light it up, clean it up, and make it work, literally. And as that has happened, the floods came with the rain, and maybe put some things on the back bench. Lest you forget, Nairobi still needs help. We're hearing from you this morning. 0732 142 653 or 07132 142 650. What's your take in terms of what's going on where you are? Yes, sir.
Lest you forget that the national and county governments are in charge of healthcare in the country. Lest you forget that Kenyans today are paying contributions to SHA for them to be able to access healthcare. Lest we forget that the very same Kenyans find it difficult to go to hospitals to access the very same services that they are paying for. We're not saying that those who out here say that SHA has worked for them. It's fine. But remember, like we keep on saying, that when you are in a factory and a single item, a single shot does not have, what do you call it, a button, what happens to that shot? It is condemned.
Yeah.
That means, for even if it's 3 million Kenyans who are paying for SHA, if a single Kenyan is unable to access services, that system ceases to operate and to function as expected. As we speak today, we have stories of machines in hospitals that are not working. One asks the question, for Kenyans who are unable to access services because this machine has been down for the past 3 months, is really SHA, is really healthcare as stipulated in the Constitution that each and every single Kenyan has the right to healthcare in the country? Is it working for them? Lest we forget that over and over again we've been told that SHA is working. But we'll also not bury our heads under the sand and assume that we do not see the problems that do exist. Today, we ask the question, just how much was spent in setting up the system? And why did we spend that much? Do we have answers as to why we had to take that direction? But now that we have the system in place, is it working?
Yeah.
Are the individuals who are running these offices able to come and tell us how exactly this system is working? Because it is one thing to give good reports. It's one thing to stand on podiums to tell us that it's working. But it is Kenyans who are accessing these services who will tell you the truth. They are the ones who will give you the report card on whether healthcare is working or whether it is not working. We talk about a healthcare system where we see billions and billions of shillings getting lost on a daily basis. One asks the question, these billions that are getting lost, yet we are in a system where we see equipment not working, medication and drugs are not there, doctors are not paid in time, pending bills do exist to tunes of billions and billions in healthcare and many other services in the country. One asks the question, what exactly are we doing to ensure that Aseto, Ndu and many other Kenyans access quality healthcare? Is it just on a manifesto and it remained there? But when it comes to implementation of the same is a zero. Lest we forget that Kenyans do deserve quality healthcare, not just on paper, but in the workings.
Yeah, and I think that we hear the alarm sounding. For some reason, we're not picking up the phone here because the committee talks about so many red flags that are popping up all over the place. And I'm just saying, if you spent 104 billion shillings to sort out the thing, it better work. It should actually work, and that just beyond the money, that there's a duty of care that is necessary for the people. And I'm just going to go back to the Kenyatta National Hospital. Again, we're looking at East Africa's largest referral hospital, and that what they tried to do in some cases was decongest that hospital. Whereby they said in the health system, you have your level 2, 3, 4, 5, and then, of course, now 6. You don't want the person who has the sniffles going to Kenyatta.
Yes.
You don't want the person who needs a procedure done going to Kenyatta National Hospital. You want to keep, that's why there's referral in the name.
Yes.
You want to keep it for those cases where a lower level health facility is not able to achieve. But then again, the health system was poor in the sense that the 2, 3s, and 4s had, and in some cases 5s, had not been equipped enough. And I'm not just talking about equipment, the hard machines. I'm talking about also with the staff that were needed, or with the medicines, unfortunately, in some case. But over time we see, and whether we like it or not, at the time when Omar Luga was working with NMS is when we saw that we had a lot more in terms of level 2, 3s than established